those with limited income and resources. It's means tested, so it does test what your income is. And a person qualified for both Medicare and Medicaid, we call those dual eligible. And then basically what we want to do is break it down on the Medicare part of it, excuse me, to Part A and Part B. Okay, and then also we'll go over supplement insurance, employee retiree insurance, and then alternative to Medicare, that's where what we call the Advantage Plan, where you leave original Medicare and go to private carrier. Those are like the Humana, the Aetna, the Blue Cross, all of those that have an Advantage Plan. So first, let's go over what Part A is. Part A is basically there's no premium due for most people. If you worked a minimum of 40 quarters of medical and paid your Medicare taxes for your premium, there's no cost for Part A at age 65. Eligible prior to 65 for some persons, example, disabilities and end-stage renal is also available. Okay, will you pay a premium? Well, if you are under the age and you don't hit that total where you paid in the 40 quarters, then you would have to pay a premium if you decided you wanted to get Part A. But most people will get the Part A at no charge. And say you are a spouse and you have never worked and so you didn't really have the ability to pay in. Well, so long as you have a spouse that has paid in and qualifies for Part A, so are you. Okay, so what does Part A cover? Well, Part A covers the room and board at the hospital. So there is a charge for Part A if you don't have any other coverages. Give you an example, an Advantage Plan or a Medicare supplement. So there's gaps in the Medicare. So if you go into the hospital and you stay, excuse me, day 1 to day 60, there'll be a $1,736 one-time charge. And you can go in and out of the hospital during that 60-day period, and that's the only charge. If you stay beyond 60 days and you're in the hospital for 61 days to 90, then it turns into a per-day charge of $414. And if you're in 91 to 150, then it's going to double at $468. So where we see most of this is, say, you go into the hospital and you only stay a day or two. Well, during that 60-day window, it doesn't matter. You have to pay that deductible. But let's say you go into the hospital and it's beyond that 60-day window. And so let's say you go in January. In April, you go back in the hospital. There's another $1,736 deductible. So that deductible is for a 60-day window. It is not an annual deductible. So to remember that those charges are for 60-day windows. So you could have multiple of those in a year's time. Also, Part A covers skilled nursing care. Now, remember, on the skilled nursing care, it's for rehab only. So if you're in the hospital for 3 days, so you have a knee replacement, and you're in the hospital for 3 days, and then they move you to a rehab center, Medicare will pay the first 20 days. Day 21 through 100, that charge is $217 per day. After 100 days or 101 days and beyond, there is no more coverage. In that case, then you revert to a long-term care coverage that would be a separate policy that you would purchase prior to needing the services. In some cases, if you have limited resources, then of course it would be then that you would be a ward of the state and be on Medicaid. But that's a whole different program. So let's look at Part B. Okay, Part B, there is a premium. And Part B is deducted from your Social Security check. So if you're drawing Social Security, that premium will come directly out of your Social Security check. Part B is optional. You don't have to take it. The premium for the penalty, for not having Part B when you need it would be 10% for each 12 full months. So it'd be a 10% surcharge. And that surcharge would stay for as long as you were in Part B. And then we pay it as long as that person has Part B. There are limited exceptions. Give you an example. If you have group coverage, so in other words, you have coverage through an employer, you have credible coverage, and you're not drawing Medicare at the time, you're going to stay on your group coverage. Well, that doesn't matter. You don't have to turn on your Part B or your Medicare when you turn 65 because you have group coverage. So if you have an employer that has over 20 employees, then you do not have to migrate to Medicare when you turn 65. I repeat, you can stay on your group coverage. And the best way to really figure out whether the group coverage is better for you than the Medicare program is to do a side-by-side comparison, and we do that for you. So we would just need your evidence of coverage from your group coverage. Bring it in. We'll sit down with you. We'll go over what your charges are, what your deductible is, what your monthly premium is. Do they cover prescription drugs? We would cost out your prescription drug coverage, compare that with Medicare, and then it's really in black and white. You will know by doing that comparison whether or not it is more advantage to you to stay on your group or to move on to Medicare. So there is an election period. The election period is if you're turning 65, so you have 3 months prior. So let's assume that just for all practical purposes, you're turning 65 in April, or you're going to leave your group coverage in April. So January, February, and March is the 3 months that you have to go ahead and enroll into your Medicare. And I'm going to tell you, take the full 3 months. And now, as soon as you are eligible to enroll or apply to Medicare, do it then. A couple ways that you can do it. You can go on to SSA.gov because there is not a Medicare office. It is done through the Social Security office. So you can call your local Social Security office and schedule a phone appointment. You can call your Social Security office and schedule an in-person if they're still doing in-person. Or you can go on to SSA.gov and enroll online. So you have a couple ways that you can do it. But either way that you do it, you need to do it 3 months prior, because how many times have I had clients come in and they waited to the last minute and there was a mistake somewhere in the Social Security file. Maybe you were divorced, or they had your name spelled wrong, or your Social Security number was wrong. Well, that has to all be corrected before they can enroll you into Medicare. So you take all of those times, all that time, because there's 3 months, and then the month that you start your coverage will always be on the first of every month, because Medicare only works when you enroll into Medicare. It's the first day of the month. So you have the eligibility month, which is April, considered that that's the month you're turning 65, but they give you 3 more months. So let's say you procrastinate. They give you May, June, and July, and that's July 31st you don't have your Medicare turned on, then you miss that what we call the IEP, initial enrollment period into Medicare, and then you have to go to a per annual, and then which that basically means that you have general enrollment period, which starts in January of every year, so January 1st through March 31st of each year, and then it will go into effect the following month once you enroll, and then again you would pay that 10% penalty. Now, Medicare has an annual deductible. So the deductible for Medicare Part B is $283 per year. No, that is not a typo. It's a $283 deductible. After that, you pay 80/20. Medicare picks up 80%, and Medicare picks up the other 20. So it kind of gives you an idea how Medicare Part A and Part B works. Well, you also need a drug plan. There's a couple ways that you can get a drug plan. So the drug plan is Part D, and the drug plan is there's a couple ways. If you're going to do a supplement, then you're going to enroll into a standalone prescription drug plan. There's a number of different drug plans out there, and it will actually depend on your zip code. Or if you're going to have an Advantage plan, then the Advantage plan, they all have an integrated prescription drug plans included with them. There's a couple out there that are made just for veterans because they're getting their prescription drugs through the VA, but that is also available through the Advantage plan. Okay, what is Part D? Well, enrollment into Part A and or Part B is required. So if you're going to be enrolling into Medicare Part D, which is prescription drug, you are required to enroll into Part A and or Part B. People who qualify for both Medicare and Medicaid, which is dual eligible, then they can also choose to enroll. Higher premium for those who wait. There's an exception, obviously. If you have group coverage and had group coverage prior to the time that you're enrolling into your Part D, there is not a penalty. But if you were supposed to enroll at 65 and did not, because you said, well, I'm not taking any medication, so I don't need that Part D drug. Well, there is a penalty. So there's a penalty that is 10% for every year that you did not enroll into Part D, and then that penalty is combined. So you give you an example, you can have over a period of time that can add up if it's because it's 1% per month. So if you have 1% penalty for every month that you didn't enroll into your prescription drug plan, and it was 36 months, well then that's 36% added to whatever you pay for a prescription drug plan. So that's the penalty. And then that's a penalty that you pay as long as you are on your Part D. Now, there is really not a good reason for not having a Part D because there's a lot of Part D drug plans out there that are zero premium. So that does not make a sense at all that you don't enroll into a Part D. Even if you say, well, I don't take anything, well, that's fine. Enroll into a zero premium Part D and you won't have that penalty. Okay, now, there was a Inflationary Reduction Act that I'm going to bring to your attention, which has really helped a lot of people on Medicare on the prescription drug plan. Because that whether it's either one that you have integrated with your supplement or your Advantage plan or with the standalone supplement. Well, in August 15 of 2022, it capped out that if you had out-of-pocket expenses of over $2,000, then you no longer paid any costs for your medication for the rest of the year. 2026, it went up to $2,100, which, believe it or not, I can tell you, prior to this, I had clients that were paying $3,000 and $4,000 a year for medication because they had some of the heavy-duty medications that they were on. So it's really important that this was a great addition. Now there's always some trade-offs. So prior to this, there was a lot of free medications that were available under Tier 1 and some Tier 2 drugs. So a lot of those that were free at that time, there is some premium co-pays that is assessed with it. But overall, the difference in what the coverage is, so it just adds better coverage for clients out there that really do need it. So the next thing we're going to go over is let's talk about Medicare supplements, okay? So if you want to do away with all those co-pays, on the Part A, that $1,700 every 60 days if you went into the hospital, the 20% that you would have to pay, 80% that Medicare pays, but you're responsible for that 20%. Well, there's a couple ways that you can cover that. And one of them is going to be through the Medicare insurance, supplemental insurance. This is covered by private carrier. There's more than 50 carriers out there with the exact same plan. They're offered by insurance companies under strict guidelines. All Medicare supplements plans with the same letter category have identical standardized benefits. So in Medicare, you're going to find that there is Plan G and there's Plan N. Those are the two that you're really going to look at. The other two are really, they're financially, they're not a good buy. And then, of course, Plan F is available if you had turned 65 prior to 2020. Well, at this time, the majority of them is beyond that point. So the only way you get Plan F if you had enrolled prior. But I can tell you now, if there's anybody out there that still has a Plan F program and you're being covered under Plan F, you don't want Plan F. Because, like I said, there hasn't been any new people added to Plan F since 2020. So basically, everybody that's on Plan F are usually people that could not move on to different plans. And the cost of that coverage has skyrocketed. And so it becomes no longer cost efficient. So if you have a Plan F, the best thing to do, sit down with us, because there is one carrier out there that does not ask any health questions, and we can move you to a different plan, a Plan G or a Plan N, and save a lot of money. And I have yet to see anybody in a Plan F that wasn't excited to get off of it. So what is Plan G? Well, Plan G basically covers all of those expenses. The only thing that you would have to cover is that annual deductible. So once you pay that annual deductible, Medicare picks up everything. The only thing you're responsible for then is your annual deductible. All of those expenses that you would have had to pay for your Part A, you go into the hospital, come out of the hospital with no charges because your supplement picks up all of those charges for you. And then as far as your Part B expenses are, the 20%. So if you go to your doctor and there's a charge for your copay to see your doctor, once that deductible is paid, there are no longer any copays that you would have to pay to see your doctor or your specialist, or even any of the diagnostic treatments that you would have to have, maybe you have X-rays or MRIs or any of that, or say you were diagnosed with cancer and there's copays for a lot of the cancer drugs out there, And also, if you have radiation or chemotherapy or any of those things, those are charged at 20%. So that 20%, then you would not have to cover it. It would be included in your program. So a lot of people will choose to select that supplement. Another reason why that supplement is important for a lot of people on Medicare is there are no, there is not any type of certain programs that you have to be on. You're covered nationwide. Well, we're good. That sound that you hear means that we have a break coming up. And when I come back from break, I'm going to continue on with the coverage that we have for the supplement and then also move into the Advantage plan. So I'll see you in a couple. Thank you.
Hey, everybody. This is Dan Gilley, and you are listening to Medicare Made ABCD Easy. We'll be back in just a few short moments. Hey, and welcome back. We are here with Dan Gilley, Medicare Made ABCD Easy.
Yes, welcome back from our mini break there. Obviously, if you'd like to call in, it's 847-931-1410. That's the call-in number. Then obviously we have our reservation line. If you want to call in, leave your name and your contact information, and then one of us, either Julianne, Eric, or myself, will get back to you at 630-320-6906. Or you can go onto our website, DivicG, so it's DDGinsurance.com. So it's DDGinsurance.com. And on that website has all of our information. You can click on that you want to leave a message for Julianne or one for Eric or myself, Danny, and we will get back to you usually within that day. If not, within 24 hours, we try to get back to you. Okay, so let's continue on where I left off. That we were talking about Medicare supplements. The one thing about Medicare supplements, the reason why a lot of our Medicare recipients prefer that other over some of the Advantage plans is, number one, you have nationwide coverage. So let's say by chance you're in Elgin and you are so fortunate because you got to move in the wintertime to Arizona, Florida, or even to Tennessee. I love Tennessee. But anyway, you don't have to worry because that supplement that you have is good nationwide. So if you want to know if your doctor takes, if You call your doctor. You have a doctor that you want to see. It's a new doctor. You call them up and you just simply say, do you take Medicare? And if they say, yes, we take Medicare, okay, you have nothing to worry about. That supplement, your doctor will take your supplement. Because remember, the federal government and all hospitals have to take Medicare. So you're covered there. And because this is a Medicare program under your supplement, it's still part of original Medicare. So if you call a doctor and they say, yes, I take Medicare, that's all you need to know. So there are no networks. There's nothing like a PPO or an HMO. Forget about all that on original Medicare. You can go to any doctor, any hospital in the United States that takes Medicare. So that's a large network that you have. So in people that really want to have the premium coverage for your Medicare, in other words, you want to take that Medicare and turn it into your best coverage that you can get as a Medicare recipient. And when I say best coverage, because basically it's when you decide that you want to have any type of surgery done or anything like that, Medicare has one rule. It has to be medically necessary. Getting approval by Medicare is much easier when you have original Medicare and you have a supplement, okay? So that's one of the big differences. And I'm going to go over the Advantage plans now in just a few minutes. But I'm going to tell you, if I could talk about a downside to the supplement, I would say the monthly premiums are a little higher. But I can tell you, unless you have a crystal ball, and you look at that crystal ball and it says to you, no, you're not going to have any major issues. Maybe you might want to select a different program. But if you don't have a crystal ball and you want to make sure that if something comes your way, how many times have I had new clients turning on to Medicare and then all of a sudden get diagnosed with cancer? And cancer is one of those deals where it doesn't go away. The amount of coverage and treatments doesn't just last a week or two. Some of them are months, some of them are years. And you can rack up a lot of copays, especially if there's any hospital and surgeries and stuff like that. So I'm going to tell you, if you really want to have the best coverage that is available to you, then look at that supplement, look at that Plan G. The other one is Plan N. Plan N became available in 2010, and it's a little bit different. The premiums are cheaper. You do have that annual deductible, which is a one-time deductible. But then you also have, if you go to a regular doctor, it doesn't matter if it's a specialist or whichever, then there is up to a $20 charge for every doctor that you go see. And then if you do an emergency room, there's a $50 charge for that. If you get admitted into the hospital, then, of course, that charge is waived. Then there's another charge, and it's called a excess charge. An excess charge, let's say you have a specialist that you want to go see. And he says, well, I am part of the Medicare program, but I don't accept the Medicare assignment. They're allowed a 15% surcharge that they would charge you, and there's no cap on that surcharge. And with Plan N, that surcharge, excess charge, is not covered, where Plan G, it is. There's a big difference in premiums between the two. So you could probably save $50, $60, $70 a month, depending on your age and your zip code. So it can be less expensive for you to have that plan in, but still have that flexibility to go to any doctor, any hospital in the United States. So some of our clients that do want to have that supplement will opt to do that plan in because they say, well, I'm still covered under the major costs. So if I have to pick up a couple co-pays if I want to see a doctor, they're okay with it. But and every person has their own individual likes and dislikes on plans that they select. I can say that I would say at least 60% or 70% of our people, my clients, are on Plan G that have a supplement. The others are on Plan N. All right, let's talk a little bit about what Advantage plans are and how do they work. Okay, so Advantage plans. What I'm gonna do is I'm gonna put the supplement and the Advantage side by side, so that we can kind of have a good view of the two. So on the supplement, we already know that there are no co-pays except for the deductible on Plan G. On Plan N, there are those small co-pays. Part B deductible on Plan G and Plan N. Now, on the Advantage side, remember I said on the supplement side, you can see any doctor, any hospital in the United States that take Medicare. Well, on the Advantage side, you're going to have to choose. There are HMOs and there are PPOs. So what you have to do, and when I have a client that wants an HMO or a PPO or on an Advantage plan, the first thing I do is get the doctors. Your PCP doctor, that's a doctor that really directs you to any of the specialists. Find out if that particular Advantage plan has that doctor in their network. So the best way for us to do that is get a list of all your doctors, your specialists, your PCP doctors. And then I try to find a plan that matches up with all of your doctors, okay? And it could be an HMO or it could be a PPO. Now, if you travel outside of your immediate area, then I do not recommend an HMO. Because on an HMO, of course, if it's an emergency, you'll have coverage nationwide for an emergency. But once you get stabilized, you have to go to your local hospital that's in the network. So that's a huge downside, especially if you're traveling outside of your service area. And some of the PPO programs out there does offer you some coverage in other areas because some of the large carriers like Humana, Aetna, Blue Cross, they have networks throughout the nation. So sometimes we can get that coverage outside of your local coverage. But on an HMO, definitely not. You have to be in your local area. There's co-pays. In other words, the Advantage plans are all set up with co-pays or shared expense plans. So you will have, there's not a deductible with the Advantage side, but you would have a co-pay. And now, majority of the HMOs and the PPOs, there is no charge for your PCP doctor. There is usually not a charge or a co-pay on most of them. The specialists, there is a co-pay. There's out-of-pocket expenses. So remember, we had used that example that if you had a cancer treatment, well, if you have a Medicare Advantage plan, then there is what we call co-pays. And a lot of those radiation and chemotherapies, there's a 20% copay for every one of those that you go to. So that can rack up with copays. Now, the one thing that they do have on that Advantage plan, depending on which plan that you're on, usually the HMOs have a smaller maximum out of pocket. So what maximum out of pocket means is if you add up all of those copays, and you reach that magic number on that plan that you're enrolled into, then you would have 100% coverage thereafter. So in an HMO, those are going to be lower. On a PPO, they're going to be a little bit higher. But on a PPO, let's say you went out of network, because on a PPO, you can either go in network or you can go out of network. If you go out of network, all those co-pays are going to be considerably higher. And that maximum out-of-pocket that you have to assume before you get that 100% coverage is going to be considerably higher. So on the Advantage side, remember, this is based on your amount of coverage that you utilize. So if you are a perfectly healthy person, you don't have any issues whatsoever, and you go, well, I only see the doctor once a year. I'm not on really any medications to amount to anything. I think I can save a lot of money on that Advantage plan. Yeah, you probably can. And then Advantage plans also offer some benefits that you can't get on supplements. For instance, some of the Advantage plans will offer some dental coverage. Those are usually under the PPO, so you have to go to the dentist in that network. And they also, some of them offer some eye care. In other words, you can get your eye exam done as part of your Advantage plan. So there are a few things that you can get on that Advantage plan, and a lot of them in the Elgin area especially are at zero premium. So you don't pay a monthly premium, you just pay as you go as you need the services. Again, on that individual that finds their PCP doctor and their specialist on that one Advantage plan, a lot of them look at that and say, well, at this point in time, I'm really not using a lot of those healthcare dollars. I feel that I want to take that chance, and I'm going to stay with that Advantage side and have less cost factors. And that's true, and I tell people that if I compare the two, when I sit down with you, I want you to see what the apples and oranges are. I want you to see what the supplement is and how it works. I want you to understand how that Advantage plan works and what the costs of one of those are. Now, I'm going to give you some of the downside of that Advantage plan, okay? So let's say you have the Advantage plan, and now all of a sudden you're starting to get hit with all of these charges. And you say to me, these charges are getting a little expensive, and you're having a hard time because if you need any services on the Advantage side, that insurance company that is private carrier has approval, so they will approve whether or not you get that service or not. And the approval time can take much longer. So instead of on the supplement side getting the approval right away, sometimes you have to wait a month or so before you can even get the service done that you need. Those are some of the downsides. Another one of the downsides is, let's say you had a knee replacement and now you had to go to a rehab. A lot of those Medicare Advantage plans out there and a lot of the rehab facilities won't even accept Advantage plans for rehab. So there's some downside to it. So what you need to know exactly what you're buying, what the coverage is on each one of those plans. Separate yourself, because on that Advantage plans, you're going to have networks. And if you travel outside of your service area, you're going to find that you're really, it's going to be difficult. So I would recommend that if you really want to have the best coverage that you get in the Medicare world, I would look at the supplement. But then if you're healthy and you go, okay, hey, there's nothing wrong. I go to the doctor once a year. I don't have to pay a monthly premium, and I get my PCP doctor is free. Hey, that's really kind of hard to turn down. But the reason why I go through all this with my clients is I want you to make that decision. I'm not going to make that decision for you. All I'm going to do is I'm going to spell it out for you. And then I'm going to say, okay, you decide, and I will enroll you. I will do all the paperwork for you. I will set you up on the plan. And each year when the Advantage side comes up, and one of the disadvantages with the Advantage side is there's no guarantee that you each year that plan that you have will keep the same doctor list, because we've seen networks drop doctors out of different programs, and then we have to find a different program to get your doctor that you want. So it could be a different Advantage plan. But again, that's something that we do for you every year. We go through that. So there are some disadvantages. There are some different things that you have to do and have to be aware of, because you can't just assume that Advantage plan is going to stay with all the same doctors every year, because we do see those changes. And we've seen those changes more this last couple of years than we have in the past. Now, I'm going to talk to you just a little bit about the supplement. Now, we've seen some large rate increases with the supplements, and more so than we have seen in the past. But when you look at the scheme of things and the total cost of healthcare dollars, you really can't beat the price of that supplement, knowing of the type of coverage that you have. And so I leave it up totally with you as the individual. Now, if you're on a supplement and you decide that during the annual enrollment period, you can switch your supplement to an Advantage plan without any problem, so that October 15th through December 7th, we can switch you to that Advantage plan if that supplement cost is getting more than what you can handle. Unfortunately, if you're on a Advantage plan and you decide to switch to a supplement and you're outside of that initial enrollment into Medicare, they can ask health questions. And when they ask health questions, then the supplement company can decline you. So there are a couple of reasons why that when you decide on what type of coverage that you want during that initial enrollment period, it is important that you understand totally what your options are. Now, keep in mind, there is always that one company out there that does not ask any health questions and moving from the Advantage side to the supplement side, but their premiums are higher. Well, that kind of wraps up everything. Remember, our reservation line is 630-320-6906. Our website is ddginsurance.com. This is Danny Gilley signing off, and I'll see you the first Tuesday of next month. Thank you.
And folks, once again, we'd like to thank Dan Gilley for a wonderful show, Medicare Made ABCD Easy. We'll see you again next time, and thank you for tuning in.